Okay, let's talk about smoking. First, we're going to talk about what happens to your body when you inhale smoke. Then we'll talk about how to quit. And lastly, we'll talk about what type of screening tests that you need because of your smoking history. I think everyone knows by now that smoking causes lung cancer, but it's important to me that you know exactly how this is happening in your body. Every time you smoke, the smoke damages the lungs and causes a few cancer cells to form. Now, the cancer cells don't survive very long because your body kills those cells before they can turn into a tumor. Your body is really good at protecting itself when you're young. If you've smoked for years and years, there's been a constant war going on in your lungs. The smoke causes cancer and your immune system storms in and wipes it out. The problem is that each time your body kills the cells, it also kills some of the normal cells too. This causes scars to form in your lungs. So the result is you get short of breath easier, you can't walk as far, and you start coughing more and more. Smokers usually feel tired all the time, and they get sick with things like pneumonia and bronchitis frequently. If you've smoked for more than 30 years, this is going on inside of you right now, and it's called emphysema. The other name for it is COPD. Okay, let's get back to lung cancer for a second here. So when you get older and your immune system has been fighting this war in your lungs for years and years, the system that finds and kills the cancer cells starts to wear out. It can start to miss cells, and when that happens, a tumor can start to grow. Now, these sorts of lung cancers and tumors tend to take several months, if not years, to get big enough before you even know they're there. One day you might just start coughing up blood or losing weight, and by that time, it could be too late. With lung cancer, the single most important thing is to find it early. If you catch it early, lung cancer is very curable. But if you wait until you have symptoms, the tumor is usually so big that it's spread to the other parts of your body. So just like people get colonoscopies to look for colon cancer, we get what's called a low-dose CT scan of your lungs. And this creates a three-dimensional picture for the radiologist to look at your lungs to see if there are any signs of lung cancers that are brewing. These CT scans are done next door at Baptist Hospital, so it's all right here in one place. Another nice thing is that your insurance company will completely pay for this because they know how important it is to catch this stuff early. All right, one last thing I want to mention about screening, and this only applies to men, but for some reason, only in men, smoking seems to cause aneurysms to form, particularly in your aorta, which is the biggest blood vessel in your body. An aneurysm is a weak spot in the wall of your aorta, and that spot can balloon out into a bubble. Over time, the bubble can get bigger and bigger, and the wall gets thinner, and ultimately the blood vessel can pop. Now in smokers, this process happens over 5, even 10 years. But if the aneurysm ruptures, you have about a 90% chance of dying before you get to the hospital. And that's why we screen for these things with ultrasound, is because we want to find them when they're small. So if you are a male between the age of 65 to 75, we need to have a discussion about ordering this test. These are also done at Baptist using an ultrasound machine, and the whole test takes about 10 minutes to do. Okay, I want to give you a few other pearls about smoking. Studies show that smoking shaves 10 years off of your life. Bottom line, 10 years. Smoking can also cause bladder cancer, so if you notice any blood in your urine, let me know. But besides all the ways that smoking can damage your body, here's another reason to quit: the money. If, instead of smoking for the past 30 years, you saved the money you'd spent on cigarettes, you'd have $200,000 in your bank right now. Instead, you've been giving that money to the people who own those tobacco companies. So just think about that for a second. Okay, so what can we do about this? Well, there's 2 medicines that can help you to quit. One is called Wellbutrin, and the other one's called Chantix. And I'll talk about each one individually. Let's talk about Wellbutrin first. So Wellbutrin is a pill that you take every day, and it makes smoking less pleasurable, so you don't enjoy having a cigarette as much as you used to. It also helps with the weight gain that sometimes people get when they quit smoking. In fact, one of the side effects on the label is weight loss, so that's a nice bonus. We usually keep people on this medicine for about 3 months while they're trying to quit smoking. Now, there's been a lot of money spent on lung cancer research, specifically how to get people to quit smoking. All those cancer telethons over the years, part of what they're doing with that money is to fund studies to see how we can get people to quit smoking. And the reason I bring that up is, here's what they've found. If you take Wellbutrin, it doubles your chance of quitting smoking. Now, briefly, just in terms of the side effects of Wellbutrin, in some people it makes them feel a little bit anxious and have nausea, but most people tolerate this medication very well. But the other thing I do want to mention is if you have seizure disorder, this medication is not for you. Now, the next medication we're going to talk about is Chantix. And when it comes to Chantix, I found that people either love it or they hate it. But the studies show clearly that this is actually the best medication to help you to quit. If you take this one, it will triple your chances of quitting. So let's talk about how it works. Chantix blocks your craving to smoke, and it eases the nicotine withdrawal that happens when you try to quit. So it works differently than Wellbutrin. And I point that out because a lot of times we use Wellbutrin and Chantix together. Now, probably the most common feedback that I get on this medication is that it causes people to have very vivid dreams. They're not nightmares, they're just very lifelike dreams. Otherwise, people usually do well with this medicine. And once again, just to throw this out there, if you have bipolar disorder, this medication is not for you. Okay, one more little pearl about Chantix. There was actually a study that showed if you take both Chantix and Wellbutrin together for 3 months, this actually gives you the very best chance of quitting. So that's why I always recommend that if you're serious about quitting, you start both of these medications simultaneously. We put you on the medicine for 3 months, and the people who stick with it almost always quit. So regardless of how you want to do this, if you want to do one medicine, if you want to do both or none, my advice for quitting is the same. Count up how many cigarettes you're smoking per day now, and smoke one less cigarette per day until you are completely off of the cigarettes. So it's like a slow taper. It's completely fine to use the nicotine patches when you get down to only a few cigarettes per day because you're probably going to start having some nicotine withdrawal. My advice on those patches that are over the counter is that you want to get the strongest dose, and you want to wear those things for about 2 weeks after you've completely quit smoking. Okay, one last thing I want to mention to you. Baptist Hospital actually has its own smoking cessation counseling hotline, and I've actually got a handout for you that gives you more information about this. But basically, it's a group of counselors who are trained in helping people to quit smoking, and it just provides you with some accountability. These people will call you and they'll check on you, they'll give you advice on how to quit. And the studies actually show that having someone who keeps you accountable is a big part of quitting. Okay, that's it. Thanks for hanging in there, and I hope we can get you off of the cigarettes.